The electrocardiograph is an instrument used to record the electrical activity of the heart. An electrocardiogram, or ECG, is the graphic representation of this activity. The most common reason for running an ECG in the medical office is to diagnose the presence of an irregular heart rhythm known as dysrhythmia. The medical assistant is responsible for recording electrocardiograms. It is important that the medical assistant produce a clear and concise recording that can be read and interpreted easily by the physician. The medical assistant must prepare the patient, operate the electrocardiograph, identify and eliminate artifacts, and maintain the electrocardiograph machine. Work in a quiet, relaxing atmosphere away from sources of electrical interference. Sanitize your hands. Greet and identify the patient and introduce yourself.
Hello, Mr. Presti. My name is Vicki. I'm the medical assistant who will be working with you today.
Identify the patient by his full name and date of birth. Help the patient relax by explaining the procedure. Tell the patient that the procedure is painless. Explain to the patient that he must lie still and not talk during the recording so that an accurate reading can be obtained. Patient movement or talking can cause muscle artifacts to appear on the ECG recording. Prepare the patient. Ask him to remove all clothing from the waist up. The lower legs also must be uncovered. Assist the patient into a supine position on the table. The arms and legs should be supported and not be allowed to dangle to prevent muscle artifacts on the recording. Properly drape the patient to prevent exposure and provide warmth. Support the patient's head with a pillow if desired. If the patient is uncomfortable or cold, this can result in muscle artifacts on the ECG recording. Position the electrocardiograph machine. It is usually easier for the medical assistant to work on the left side of the patient. The power cord should point away from the patient and not pass under the table to reduce the occurrence of AC artifacts. Prepare the patient's skin for application of the disposable electrodes. If the patient has oily skin or has used lotion, wipe the area to which the electrode will be applied with alcohol and allow it to dry. If the patient's chest is hairy, dry shave it at each electrode site before applying the electrode. The patient's skin must be dry and free of oil and body hair for the adhesive backing of the electrode to stick to the patient's skin and stay on during the procedure. Apply the electrodes to the fleshy parts of the arms with the tabs pointing downward. Apply firm pressure to the electrodes to ensure good adhesion of the electrodes to the patient's skin. Apply the electrodes to the fleshy parts of the legs with the tabs pointing upward. Firmly press the electrodes onto the patient's skin. Positioning the tabs correctly creates a more stable connection when the lead wire is attached. Otherwise, the electrode may pull away from the skin, resulting in a wandering baseline artifact on the ECG recording. Properly locate each chest position and apply the chest electrodes with the tabs pointing downward. Firmly press the electrodes onto the patient's skin. Continue until all 6 of the chest electrodes have been applied. Chest lead V1 is located at the 4th intercostal space at the right margin of the sternum. V2 is located at the 4th intercostal space at the left margin of the sternum. V4 is located at the 5th intercostal space at the junction of the left midclavicular line. V3 is located midway between positions 2 and 4. V5 is located at the horizontal level of V4 at the left anterior axillary line. V6 is located at the horizontal level of V4 at the left mid-axillary line. To ensure good adhesion of the chest electrodes, you may want to apply a piece of hypoallergenic tape over each electrode. Loose electrodes can result in a wandering baseline artifact on the recording. Connect the lead wires to the electrodes. This is accomplished by inserting an alligator clip onto the metal tip of each electrode. The alligator clip is attached to the tab of each electrode. The ends of the lead wires are usually color-coded and identified with abbreviations to help the medical assistant connect the proper lead to each electrode. Arrange the lead wires to follow body contour to reduce the possibility of AC artifacts. Plug the patient cable into the machine. Support the cable on the table or the abdomen to prevent pulling or twisting. Turn on the electrocardiograph. Enter patient data using the soft touch keypad. Always use your fingertips to enter the data. Pencils or other sharp objects can damage the keyboard. As the data is entered, it is displayed on the LCD screen. The patient data that is entered includes the patient's name, a patient identification number, the patient's age, sex, height, and weight, and any cardiac medications the patient is taking. This information is printed on the recording and is used by interpretive electrocardiographs to perform a computer analysis of the recording. Remind the patient to lie still and not to talk. Press the auto button and run the recording. The machine automatically inserts a standardization mark at the beginning of the recording, followed by the recording of the 12-lead ECG in 3-channel format. Check the printout to see if the standardization mark is 10 millimeters high. If it is more than 10 millimeters, adjust the standardization mark according to the manufacturer's instructions and run another ECG. Check the direction of the R wave in lead 1. If your patient's limb leads are hooked up correctly, the R wave on lead 1 should have a positive deflection, meaning the wave deflects upward from the baseline. If the R wave falls below the baseline, the limb leads are not hooked up correctly. Reattach the limb leads correctly and run another ECG. Observe the recording for artifacts. If the artifact is present, determine the cause of the artifact and correct the problem and run another ECG. Tell the patient that you are finished and he can now talk or move. Turn the machine off. Disconnect the lead wires. Remove and discard the electrodes. Assist the patient in stepping down from the table. Sanitize your hands. Chart the procedure. Include the date and time and the name of the procedure. Place the recording in the patient's medical record and put the record in the appropriate place to be reviewed by the physician. Return all equipment to its proper storage area.